Good morning. My name is Brett Fairbairn. I'm President and Vice Chancellor at Thompson Rivers University. We're all joining this special town hall meeting virtually, but everyone has their feet on the ground somewhere. For me, that's in Secwepemcúlecw, the unceded and ancestral land of the Secwepemc. At TRU's Kamloops campus, I acknowledge to Kamloops to Secwepemc as our first house. Wherever you are, I ask that you acknowledge the land and remember those who came before you and who have stewarded it since time immemorial and continue to do so. The land makes us who we are. It inspires us, it sustains us. The plants, the water, and the air make us healthy. Indeed, as we've been reminded since the start of this pandemic, outdoors is one of the healthiest places for us to be. I'd like to welcome everyone who's been able to join us for today's event, which brings together our sector in order to connect with representatives from the Provincial Health Office. I understand we have well over 300 people attending at this instant. All of us are focused on planning a safe return to on-campus learning, teaching, and research for this fall. The Go Forward guidelines that were prepared last fall have served all of us well in our planning. They've helped us reduce the spread of COVID-19 and ultimately keep our communities safe. The updated guidelines, which are currently being prepared, will no doubt play as important a role in the weeks to come. While we wait for the updated Go Forward guidelines, we've all now received a primer document, which will help us plan as we wait for the more fulsome version that's expected in June. I'd like to thank all of those who've been working on the Go Forward guidelines, and I want to recognize the exceptional engagement and involvement of our wide sector in this critical document. While there is a level of excitement to move back to on-campus life, I know there's concern and hesitation amongst some faculty, staff, and students. We expect come late summer and fall that we'll be in a much better situation than today. I hope today's event will help ease some of the anxiety that's present out there. We'll be hearing directly from the Provincial Health Office, which has our safety at the core of their decisions. I want to express deep and sincere thanks to Dr. Henry, Dr. Emerson, and Dr. Gustafson for taking the time out of their very busy schedules to be here today. I'd also like to thank the Ministry of Advanced Education and Skills Training for helping us make this event happen. And I'll now hand over to our moderator, Matt Milovic, who will then turn it over to Dr. Henry and her team.
Thank you, Brett. Good morning, and thank you for taking the time to be with us today. My name is Matt Milovic. I'm the Vice President, Administration and Finance at Thompson Rivers University, as well as the Chair of the Provincial Go Forward Guidelines Steering Committee, and I will be moderating today's Q&A with the Provincial Health Office. Before we get to that, though, I'd like to welcome Dr. Bonnie Henry to introduce herself and her team and to offer any introductory remarks. Dr. Henry.
Thank you, and thanks for the opportunity to be with you again today. I will start off by acknowledging that I'm talking to you today from the traditional and unceded territories of the Lekwungen-speaking people, now known as the Esquimalt and Songhees First Nations, and I'm very grateful to be able to live and work on these wonderful lands here. I want to introduce two of my our team, our small but mighty team. First, Dr. Reka Gustafson, who is the Deputy Provincial Health Officer and Vice President of Population Public Health at the Provincial Health Services Authority, but importantly runs our research surveillance team at the BC Centre for Disease Control. And I know Dr. Gustafson has been very involved in working with the post-secondary community over the course of the 15 months of this pandemic, and has a lot of knowledge and understanding, and will be working with us, will be answering questions with me here today. And also Dr. Brian Emerson, who is in my office here in Victoria, and has been the lead on some of the detailed part of the workplace program that we've been working on, including working with WorkSafe BC and leading our teams that put together workplace guidance for many different workplaces, including, of course, post-secondary institutions. I just want to start by saying as well that we are in a very different place now than we were even a few months ago when we had the opportunity to speak by teleconference. But we are in a place where we have an important new tool on our side, and that's immunization. And the vaccines that we have that are available now, we are learning more and more, are very both safe and effective. And we know that when we get people protected through vaccination, that allows us to learn how to move through this pandemic in a new way. And we are working with our colleagues across ministries and across government to come up with our Restart 2.0, if you will, or the new way that we will start getting into a post-pandemic world. And I say that very specifically. We've learned a lot about the virus, SARS-CoV-2, and the disease it causes, COVID-19. And we learned who are most at risk and how it's transmitted and what we can do to protect ourselves both in our social and home interactions as well as our workplace interactions. And that is what will get us through this pandemic. But the virus is likely to be with us for a long time. So we now have the tools that we need to learn how to live our lives with COVID being part of it, whether we want to or not. And so we've learned now that the protection that we get from immunization is enough that it protects our healthcare system, it protects individuals from getting severe illness, and we are now learning as well from great data in the UK in particular that immunization reduces our risk of being infected ourselves, but also reduces our risk of transmitting if we do get infected. So these are all really important things that we have learned in the last few months. So as we move into the next 2 months, as of last week, we are now in a place in Canada and in BC where we've gone from a paucity of vaccine and having to mete it out based on risk to a plethora of vaccine. We have a lot of vaccine arriving as of late last week and this week and through May and June. So we are confident that we'll be able to provide first doses to all adults in British Columbia, and we now have Pfizer vaccine that's approved for use down to age 12, and we're looking at how to include teenagers and young people into our program. But we'll be providing first doses to all adults by the middle of May or by the end of this month, and then we'll be moving on to second doses. So this is really important because it means that we're going to be able to protect people who are most at risk of having severe illness, and we'll be able to do that in a very fulsome way before the next post-secondary school sessions start in September. So we are in a completely different place than we were even a few months ago, now that we understand how well these vaccines work. So that's a little bit of a preface that I want to put around our discussion today. There's a lot of details. I know there's a wide variety of anxieties and confidence that people have about how we're going to move through the next few months. And some of those details we have, some things we're still learning. We're still learning a lot about this virus, about the vaccines, about how things work. But we do know a lot more than we did even a few months ago. So with that little bit of a preface, I know there's some really detailed questions, and I think what I'll do is turn it over to the moderator and we can answer those questions, and that'll be the best way of helping address some of these concerns. I just want to say that we are going to be living with this virus in our lives for some time, but it's not going to be as disruptive as it has been during the last 15 months. And that is part of our goal and our need in public health and as a society to try and make sure that we can get to the point where we are protecting people from severe illness, where we're protecting our healthcare system, and then we are getting back to our lives in the way that we need to. And from this perspective, making sure that we're providing those learning opportunities, those research opportunities that are so critical to your mission as educators in the post-secondary world. So this is what our plan is to support you in every way that we can to make sure that it is a safe environment as we move into the fall. There are still unknowns, but we'll work through those unknowns together and do the best that we can to protect everybody as we go through the next year of learning how to recover from this pandemic. And I'll leave it at that and turn it over to, I don't know, Rekha, if you wanted to say a few words before we start.
No, I guess the only thing is I really want to thank everybody for being here and persevering through this year. And the work you do, the importance of the work you do in nurturing the minds and hearts of young people has never been more obvious than when some of that became a lot harder to do. So I just, we know that young people and young adults have had a significant impact from this pandemic. They aren't at risk of the serious or much lower risk of the serious outcome of COVID infection, but their social, economic well-being has been really seriously affected by this pandemic and what we had to do to respond to the pandemic. So I cannot underestimate or underemphasize the importance of us as a society coming together and making sure that we address some of those things that have been affected by the COVID-19 pandemic, both locally and globally. And I want to thank everybody. I realize I do actually to some extent realize what it took to put education online and the amount of time that it took and effort it took. And I want to thank you for that, for keeping as many young people engaged as possible. And I look forward to your questions.
Thank you, Dr. Henry and Dr. Gustafson, and of course, welcome to Dr. Emerson, who's been a great partner with the Go Forward Guidelines Steering Group for the last number of months. So those comments are great context for a start of today's discussion. I'll just get a little bit more, I'll give you a little bit more context about the town hall today. So the goal of today's town hall is to talk about the preliminary public health guidance for September 2021. Provided in the COVID-19 Return to Campus Primer that we released at the end of April of this year. In the fall of 2020, TRU did a town hall for its entire community with its public health officer, Dr. Carol Fenton, using the same format that we're using today. The event was very well received and gave TRU, the TRU community, the assurances that the university's COVID plans and actions were aligned with public health thinking. So the Go Forward Guidelines Steering Group thought it would be a useful exercise to replicate that town hall to discuss the Go Forward Guideline Primer on a provincial level. I'm pleased to say that we had over 100 questions submitted on the Slido app, and while we can't get to all of them, we will address the ones that were upvoted the most as a priority. Not all the questions were within PHO's purview to respond to, and depending on the question, those will be referred to the appropriate body, for example, employer associations. That said, the Go Forward Guidelines Steering Group will also review those questions for potential inclusion in the fulsome revised guidelines expected to be released sometime in June. The way this town hall will work is moving through a set of themes. I will direct questions at Dr. Henry, Dr. Gustafson, Dr. Emerson, and they can choose to triage them as they see fit. The identified themes are vaccinations, accommodation, Go Forward Guideline implementation, controls, international students, outbreaks, and testing. I will remind all participants that the session is being recorded and the link will be made available to all institutions as soon as possible, and hopefully that means before the end of today. So with that, why don't we jump right into the questions? So the first question, our lead-in question, the Go Forward Guideline Primer seems overly confident about the state of COVID infections for fall 2021. Why the optimism?
I'll start and then I'll turn it over to the others. But, you know, there is a level of optimism. We are in, as you know, in a third wave. We know a lot more about what we can and can't do, where the virus is transmitted and how it's transmitted. And we now know so much more about how well immunization works. And I've spent a lot of time with a number of different countries, but particularly looking at the UK. We know we have to move slowly. We know that it's going to take time until we have the virus at low enough levels. But we also know that the vaccine works really well to protect people from infection, but also from, most importantly, from severe infection, from hospitalization and thankfully from death. We know what the risk factors are. What we don't know, and what we will still need to work together on, is what's the next influenza season? What's the next respiratory virus season going to look like? So we are going to be slow and steady through the next few months. We're going to increase immunization. We're going to be stepping up again the public health team's approach to how we support every environment, whether it's a workplace, whether it's a school, whether it's what we do in our social interactions, how we do in our things like theaters and the arts. We're going to be moving through how to get society moving and back again in a way that's cautious and careful. And that includes post-secondary institutions. But we are confident that we know enough about how to live with this virus so that it is at a, it's not going to be disrupting our lives. And as Dr. Gustafson was talking about, we know that it's not only the virus, it's the measures that we've taken to control it that have been blunt instruments in many ways. We've tried in BC to do it in a measured approach with having plans in place, and for the most part, those work. So we will, of course, be looking carefully at how things evolve through next fall, next respiratory season. But we need to put this in the context of the risk and being able to manage that risk, knowing that this virus is going to be with us for some months to come. And Reka or Brian, did you want to add to that?
I have a few thoughts. So one of the things that I'd like to say is that the primer was actually put together in close consultation with public health. And I would actually describe it as appropriately optimistic and rooted in, and very realistic, and rooted in the goals of pandemic control, as Dr. Henry mentioned, which is to reduce deaths. And although it hasn't really entered the public discourse, deaths have already been reduced dramatically through immunizing the most vulnerable. Hospitalizations are now starting to decline. And the other goal of pandemic control is to reduce societal disruption. And those are equal goals. And as Dr. Henry mentioned, we tried to balance them. I would also like to acknowledge that this will require a shift in thinking, because we've spent 15 months really focusing on the public health measures, because those were the only instruments that we had in our hands. As Dr. Henry described them, they're blunt instruments. They are also instruments that have always been meant to be temporary. And in the briefings, you've often heard Dr. Henry say, this is just for now. And that's really what that was referring to, is that these measures were in place until we have a definitive intervention, which is immunization. So, but I would like to acknowledge that that will require some shift in thinking, because 15 months is a long time. And a lot of these things have become normalized in our lives. And I think it'll require your leadership in the post-secondary sector to help your community come back to why we did this. What was the goal? The goal was to reduce the damage from the virus until we have something as definitive as vaccine, and we're there. And so I think that's, and we're going to have it rolled out by the time school resumes in September. So I'm probably repeating many of the things Dr. Henry said, but I think my main point is I acknowledge that may be a bit of a challenge in a shift in thinking over the coming weeks. And that's why it's really great that we're meeting now to help that process happen over the next 3.5 months.
Excellent, thank you. It's a nice segue to the next question. The possibility of exposure in post-secondary education is up as more young adults get COVID. Why isn't a full return to in-person instruction being preceded by full vaccinations?
Well, essentially it will be, and we fully expect that all young people will have access to, and all staff at post-secondary institutions will have access to vaccine actually before the end of June for the first dose at least, and the second dose before September. So this is an important part of us all getting through this pandemic phase. And I recognize not everybody will accept vaccines or is able to take vaccines. So there's very few people right now who have an absolute contraindication or cannot have a vaccine, one of the vaccines available. So we do fully expect that immunization is what is going to make this yet another respiratory virus that we have to manage and deal with, like the many that we see during our winter season.
Thank you. And this is a common question that's been upvoted. Can post-secondary faculty and staff currently engaged in face-to-face contact with students be included in the priority vaccination program?
Yes, I think everybody wants to be a priority, but we are now at the point where we have enough vaccine and we've gone down, we've had to do it by the amount of vaccine that we've received up until last week. As I mentioned, we've done it by risk, and the risk group really is age. And so many of the faculty and staff who work in post-secondary institutions have already been immunized. You've been eligible based on age, and that age is going down across the province to 30 by the end of this week. And we expect by the end of next week, the week of the 12th of, oh gosh, I can't remember what dates we're looking at, by the week of the 17th of May, that all adults over the age of 18 will be eligible for immunization. So go out, register. That's how we do it in BC. If you register, and you'll get your invite as soon as your age cohort is eligible. And vaccines are being, usually by the time your age cohort is eligible, you get an appointment for your immunization within 7 days. So that is how the process is working. We've got lots of vaccine now. Everybody will get their turn in the next few weeks.
Excellent. Is there a requirement that faculty and students will be vaccinated before coming to class?
Well, this is one thing where we as a community and a society here in BC are encouraging everybody to be immunized. But we don't have any mandatory immunization programs in the province or in the country for that matter. I don't believe that we should have mandatory COVID vaccine programs either. Having said that, it is something we strongly encourage. We need to address people's concerns. If they have concerns, we need to make sure that they have the information they need, and that there are many different reasons why we should all be immunized. One is to protect ourselves, but it also is something we do as a community. And we've heard, you've heard the term herd immunity, or I prefer to call it community immunity. And we know now that these vaccines can be very effective at reducing transmission rates in our community after about 3 weeks. And we've seen that in those communities where we've done what we call an all-of-community approach. And Prince Rupert is a good example where 3 weeks after most adults, and it didn't have to be everybody, it was most adults were immunized, and it was around 75%. The infection rates dropped off dramatically. So it doesn't mean that, it means that not everybody needs to be immunized to get protection in a community. So that's one of the reasons why we don't believe that having a mandatory immunization program is necessary, but we strongly encourage it for everybody. And we need to recognize that immunization is not 100%. It does reduce your risk dramatically, and we're seeing that now, but there are some people who get breakthrough infections. So we still have to have other measures in place to detect outbreaks if they happen, to test people rapidly. Those are things that we can have in place in post-secondary institutions, making sure that we have those available, and making sure that we have immunization available for everybody on campus as needed. And Rekha, did you want to add to that? I think there's.
No, I think the only thing I'd like to add to that is that that, as Dr. Henry mentioned, not everybody needs to be vaccinated, but the more the better. And one of the things for people, and I think to add to that, to the level of comfort, is there's a very high degree of personal protection that the vaccine provides you as an individual. And so The most important thing, I think, for every individual is that in order to reduce their own risk, to make sure that they and their families are vaccinated. And again, keeping in mind that the vast majority of transmission is happening in the household. So that's a really, I think, a way for you to be confident. And we absolutely know that as a community, the more people get vaccinated, the less transmission that will occur in general in the community. And so there is this two ways that the vaccine protects you. But in general, mandatory vaccinations are not a policy in Canada and have not been required to control most vaccine preventable diseases.
And then the next question, I think you would have answered it, but it's nuanced differently. So I'm gonna ask it for the benefit of our audience. But the question is this: might specific high-risk settings mandate vaccine? For example, nursing students, athletes, residential students in shared living spaces.
Yeah, so again, the short answer is no, but the more complex answer is, immunization is an incredibly important tool, particularly in those high-risk settings. So healthcare workers, we have programs for influenza immunization. They're not mandatory immunization, but there are measures that you must take if you aren't immunized during the influenza season. So I expect that we will be moving towards those types of programs, at least for healthcare workers, as we move into the fall. Right now, everybody in healthcare is wearing PPE and wearing masks at all times. We will reach a point where we have a low enough transmission of this virus in our community that we probably won't be doing that all the time. But as we move into respiratory season, people who aren't immunized may need to take additional precautions to prevent being infected and prevent passing it on to others if they are. And those would be similar things that we would see in, mostly what we're seeing is people pass this virus on to people they're close to, people they live with, people they're in indoor environments, in not taking precautions, not keeping their distance, not in a structured indoor environment. And we could talk about schools being a good example of where even some minimal structure means that you reduce the risk of transmission quite dramatically. So it really is schools living, students living in group accommodation, so in living in residence, for example. And those are settings where we would want to really make sure we get everybody immunized as much as possible and protect them. And then we need to make sure that they do all of those other things that we normally do during influenza season, like staying away from others if you get sick, getting tested, and managing outbreaks if they happen. So there are lots of things that we can do to reduce transmission of respiratory infections, and we need to make sure that those are being done for this infection as well. And the same goes for athletes and teams. We know that it can be transmitted, but we also have seen that there's some very effective ways of preventing transmission even before we had immunization. So those are the things that we'll have to pay attention to, and some of that is in the guidance that's come out already.
This next question might be technical in nature, but I'm going to ask it anyway. What level of immunization needs to be achieved to have a safe fall term?
As high as we possibly can. The most people protected, the better. We're still learning a little bit about what level is for herd immunity, but what we're seeing is that there's dramatically reduced transmission in communities when you get to about 75% of even the adult population, but the whole population being immunized. So those will be goals that we'll be looking for, and that's after a single dose. But we know that after a second dose, our own individual level of protection goes up a little bit more. So it is probably in the realm of the 70-75%. But the more people immunize, the better. And I think all of us need to recognize that, to encourage. We protect ourselves, but as Dr. Gustafson says, we protect our family, those we're closest to, by being immunized.
So with that said, should we feel confident about second doses being delayed up to 4 months?
Yeah, Yeah, absolutely. You know, this is something that we spent a lot of time looking at the data and trying to understand. And as you know, it's a commitment that I made on the advice of the team. And yes, there's a couple of things. We know that your body, your immune system takes time to develop antibodies, to develop that cell-mediated memory cells immunity. So there's two different parts to our immune system. And with every other vaccines that we have, and we're learning that there's no difference from this one. If you have a booster dose a little bit longer out, you have more durable and longer lasting protection. Having said that, we want to get as many people with the best level of protection as possible. And now that we have more vaccine available, we will be able to move up that second dose for a good number of people. So it'll probably be on average about 3 months for most people, 2 to 3 months, rather than the very short time period that the clinical trials were done. So I have absolute confidence that up to 4 months is, if anything, a benefit for people, but certainly does no harm. And I know it was a little bit over 4 months that I got my second dose. I don't know, Rick, if I missed anything there.
I would just like to elaborate a little bit, and I think this is something that I observed throughout the pandemic, is that some of the decisions that we make in immunization programs and communicable disease control programs all the time became part of public discourse and sometimes a cause for concern. The optimum timing between doses of vaccine always depends on how much vaccine you have, what is circulating in the community, and how do you maximize immune response. And the interval between vaccines is as a rule a minimum interval. So what the decision to provide a first vaccine to everybody was actually made based on that notion that while there's a marginal benefit for adding a second dose earlier, there is a greater benefit to reducing both providing an individual lots of protection, but then reducing the ability of anybody else to expose you. And whatever analysis we did, whether that was based on actual infections or hospitalizations or emergence of variants, it was more beneficial to give more people a first dose as soon as possible than half the people 2 doses right away. Once you get your second dose, it doesn't matter how much time passed between your first dose and the second dose. So that's another thing for you to keep in mind, that in fact, as Dr. Henry said, it may even be beneficial to have had it longer. So I think that's just wanted to address that notion that I think something that we end up explaining to our clinical colleagues quite a lot is that interval is a minimum. And you haven't lost anything unless, of course, in that time you're exposed and get infected. But we have found that the best way to reduce both the probability of infection and to maximize personal protection was to give a first dose to everybody in the context of vaccine scarcity. Now that vaccine is not scarce, now we really are rolling it out as fast as possible to everybody.
You know, there's a bit of a nuance there, and I know this is in some of the questions too. And there have been some studies that have shown that older people, that people with certain cancers, with transplants, don't develop as many antibodies after the first dose, and their antibody response goes up again after the second dose. But a good proportion of people, about 40% of cancer patients, for example, with certain cancers, they never develop a very high antibody level. So there's a couple of things that are packed in that. We only know this from some certain populations that have been studied, people with immune compromising conditions. And there's a reason to believe that many people with a variety of immune compromising conditions may not develop as high an antibody response as a young healthy person, for example. But what we don't know is what level of antibodies do you need to be protected from this virus, from infection? And that's unclear yet. There's no what we call correlate of protection. And antibodies themselves are not the only part of our immune system that protects us. So there are some people who may not get as much protection from even 2 doses of vaccine. And again, to what Reka was talking to, it protects everybody better to have more people with some level of protection rather than trying to bump up a little bit for some people who may not mount as good an immune response. So that's complicated, but it really shows that the herd protection or the community protection that we have is best for all of us, even for people whose immune system doesn't respond as well to even 2 doses of vaccine. So that's one of the things that we're working on. I know there's some questions as well about people who are immune compromised who can't receive the vaccine, and that early on there was some, because people with immune compromising conditions, people who were pregnant, were excluded from the clinical trials. We now know that they can absolutely safely receive vaccines. So, and as a matter of fact, those are people who are more likely to have more severe illness with COVID-19. So we encourage and prioritize people with immune compromising conditions, people who are pregnant or breastfeeding, to absolutely receive the vaccine.
Excellent. I will ask 2 more questions on vaccinations before we move on to accommodation. When do you anticipate that the vast majority of young adults will be issued their second shot?
Yeah, with the vaccine supply that we expect, I expect most young adults will have their second shot by early summer.
Excellent. I think that's certainly great news for the post-secondary sector. I think I know the answer to this question, but I'm going to ask it anyway. Will employers be expected to track employee vaccination status in case of exposure?
Yeah, that's a good question. Not one that I can answer, to be honest. You know, we generally don't require people to report their, unless you work in healthcare. In healthcare, we do. But I'm not, I don't know if you have any insight into that, Brian or Reka. I mean, it is one of the things, if we do have an outbreak, it's one of the things public health will be asking to find out you know, who's at risk. So when we do an outbreak investigation, we'll be asking, you know, who was in close contact with whom and were they immunized or not. And that will, once we reach that point, when we have most people vaccinated, that will make a difference in how long and who needs to isolate after an exposure. So that will reduce the amount of people that will need to go into quarantine, for example, if there is an outbreak. But those are things that we would be doing as part of our outbreak investigation.
And the only other thing I would add to that, so I think one of the things that this question is again based in is how we're managing COVID-19 today. Case and contact management is part of the regular communicable disease control approach for some diseases, but not for others. We don't do individual case and contact management, for example, for influenza. So as the population it becomes immunized, our approach to COVID-19 will change as well. And so individual confirmation of vaccination may not be as big a part of control as it will be in healthcare. The one thing I would say, and the question wasn't about staff, but I noticed a few questions about students. The one thing that I think would be really great to use this opportunity to make sure that in our student health centers, confirming a student's immunization status the first time they visit becomes a routine practice. One of the things about young adults is that they were in the school system until then, and somebody monitored their immunization status. And often their first visit to the university may be the last time that somebody proactively checks whether they're up to date for their immunization. So I think one really great outcome would be is if we could work with our student health services and routinely make sure that when a student registers with student health services, we actually make sure that they're up to date and we can update them with immunizations such as HPV or measles or COVID-19. So I think there are things that aren't necessarily required, but can be good practices and thinking through what it is that we can do. We probably haven't had this much attention on a vaccine preventable disease in our entire career, and encouraging good practices around vaccine preventable diseases is a good opportunity.
Thanks, Rekha. I think I just heard that there's a recommendation there for a possible inclusion in the future revised go-forward guidelines. So thank you for that. So let's move on to accommodation then, and both Dr. Henry and Dr. Gustafson touched on this a little bit. So here's the lead-in question. Some students and employees are feeling very anxious about returning to campus while COVID is still with us. Under what circumstances should post-secondary institutions be expected to accommodate or create alternate arrangements for these people?
So I've thought about that a little bit, but Bonnie, if you'd like to start, please go ahead.
I just to say that living with COVID is something that we are moving to. We will get through this pandemic, as I said with my opening remarks, and I'm confident we'll get through the pandemic. But COVID is going to be around. The virus, SARS-CoV-2, is going to be with us probably for some years, causing outbreaks now and then. And hopefully, with the immunization that we have, not causing most people to get seriously ill or end up in hospital or tragically to die. What we don't know yet is whether we'll need booster doses and you know what it's going to look like, and whether there'll be periods of time where we'll need to wear masks in certain situations, that we'll need to reduce the numbers of people inside and make sure we have appropriate ventilation in certain settings. All of those important things that we do now, we will need to revisit as we go through respiratory seasons for the next few years. But I think learning how to live with this virus and be able to carry on our work is what we need to move to in our post-pandemic world. And I know, Rekha, you have some more thoughts on that from a post-secondary perspective.
So yes, we've thought about this quite a bit, and I think this brings us back to what actually increases your risk of COVID-19. And the thing that increases your risk of COVID-19 over a healthy 20-year-old more than anything else is age. And that's why we prioritized vaccination by age. There is no other risk factor that will change between the once we got everybody vaccinated, that a temporary accommodation would actually address. So I think one thing to keep in mind, as Dr. Henry said, is that once the population is immunized, the goal of the immunization is that the COVID-19 will become a ordinary or a routine respiratory illness that we know how to live with. We have influenza seasons, we have worse influenza seasons, and then we have better influenza seasons. And certainly people who are at higher risk are often encouraged to get their vaccine first and get their vaccine every year. So I think this is not a condition for which there is a rationale for which easy or an evidence-based accommodation is likely to be possible. I know this is a sensitive topic and that I am not an expert in labor law, so the nuance of that will need to be determined within each institution. But from a public health perspective and from a health perspective, once the population is immunized, it wouldn't be a population that we would say these individuals should not interact with their community in a normal way based on their health status, unless there is some reason to not interact with or without COVID-19. So I think that's that COVID-19 isn't going to be the virus that determines whether you are able to return to the workplace. And I think that's a roundabout answer. It's one that we will probably be talking about and sorting out to get to the best possible answer.
Thanks, Dr. Gustafson. Just a follow-on question to that. Any advice or guidance as to how we protect and accommodate students and faculty who can't get the vaccine for medical restrictions in working in high-density classrooms and workspaces?
Yeah, so as I mentioned, there's very few reasons for people not to get these vaccines. Some people may not want to get the vaccine, but it is all about how much transmission we have and the things that we need to do to reduce density, for example, in certain areas, particularly as we go through the phased reopening. But you know, again, with the community protection that we have with most people being immunized, that is a protection for those who can't be immunized.
Okay. Following along that same theme, some of our union members are immunocompromised or have dependents who are immunocompromised. Is it safe for them to return to campus in the fall?
And I think I talked a little bit about people with immunocompromised conditions, and yes, they should be immunized, and they need to be protected as well as everybody else. And there's no reason that I can think of that it would not be safe with the measures that we have in place to protect people. And Rekha, did you want to address that one?
Just for a moment, that I think people who are immune compromised and who live with people who are immune compromised take routine precautions in their lives, and COVID doesn't change that. And probably not in a town hall session, but I think at some point we probably want to talk about the word safe. I think COVID-19 is a virus that emerged and we live with, and we have the good fortune. I like to remind myself that a year ago that we certainly didn't know we would have a vaccine, and we have the good fortune of have a vaccine. So this is a virus that we will be able to protect people against, which is incredibly good. But with respect to those who are immune compromised, again, it's thinking through what is it that you do all the time, with or without COVID, to protect yourself and protect your family who are immune compromised. You probably take extra precautions not to visit when you're sick, and make sure that you have all the vaccines that you can have, and your family has all the vaccines that they can have. And COVID-19 doesn't change that.
Okay. I'll ask two more questions about accommodation before moving on. Should our union members be concerned if they are required to work with other people who have chosen not to be vaccinated?
And I think, you know, it speaks to all of the other things that we do on a day-to-day basis to prevent transmission of infections to each other. I don't think we will know if everybody's been vaccinated or not vaccinated. That is your personal health information. So we need to make sure we're doing everything we can to keep transmission rates low and to keep people not coming into the workplace if they're feeling unwell and if they're sick, particularly if they have respiratory illnesses. So there are many things that we do to help prevent transmission of infections, including COVID. On the other hand, I would say that we all have a responsibility, and we need to make sure that unions, leaders, thought leaders, and leaders in communities at your institution do support everybody to be immunized against COVID, because it is important for as many of us as possible to protect ourselves and protect those around us.
Excellent. And one last question on accommodation. Any advice from the PHO as to how we handle accommodation requests from students, faculty, and staff who are anxious about COVID?
You know, it's normal to be anxious about COVID. I'm anxious about COVID. I think all of us have been living with anxiety because of the uncertainty and the not knowing what was going to happen, and it has been changing, and that in itself. And we talked about, you know, the scientific process and that we're learning more about how vaccines work. We're also learning more about where this virus transmits. But when things change, that is also very anxiety provoking. And we all have a different level of risk tolerance and anxiety tolerance. And it's going to be a gradual process over the coming months to help us get to a place where we're more comfortable. And I don't know about you, but I think about it all the time. You know, somebody comes up to me on the street, and it happened to me the other day. They reached out to hug me, and it was just the thought of it. And you watch a movie and you think, oh my God, all those people are crowding together. So we've gone through a very traumatic experience, all of us, in this past year and a half. And it's not going to go away all at once. but slowly, gradually, we're going to be able to start getting our lives back. And that's the important thing. And we just need to be tolerant. We need to understand that we each have different abilities to deal with that uncertainty and that risk. And we need to be open and supportive of each other in getting through this next few months and getting back in and becoming more comfortable with how we can be together again. Because Enrique talked about this early on, particularly the young people who have had so much taken away from them and so little influence on society, whether it's influence on what they can do and when they can do it at a time where social connections are so important for our own growth and development and economic futures and intellectual futures. So we need to support each other in these next few months, recognizing that everybody's at a different level of anxiety about this, and it's going to take us time to get through into our new post-pandemic world where we can more comfortably live with COVID. So I would just say that we need to recognize that our own responses will be different, and be supportive and make sure that we have the information that people need to feel comfortable and to gradually return safely to all of the activities that we need in our lives.
Great comments. And sorry, Reika, go ahead.
And I just and we've talked about this quite a lot. We actually can learn a little bit from the K-12 sector here. The fact that schools went back into session, even to a small extent in June, was an enormous help in September. And so acknowledging that this anxiety exists and preparing for it and supporting people through it is a really good thing. Some of the things that we know is once people experience a degree of more normal social interaction without the negative consequences that they are anticipating, gradually that anxiety is going to be eased. I think some of the strategies that we can use to support each other is there was a degree of face-to-face teaching in post-secondary institutions, not a lot, but some, sharing those experiences, talking to the people and see how did you do it, and then to some extent you do have a summer session ahead of you, and I know that there's some increased face-to-face teaching that's occurring. Share your successes, share your strategies, share what happened when there was a case, because that's the other thing to keep in mind, that we talk so much about these congregate settings, and we forget that if there is a transmission in a school, the median number of transmissions is 2. So I think that's a really important experience to share with each other, and you know how to run post-secondary institutions, and I think as much as possible, sharing your strategies and sharing your successes and acknowledging that it'll be gradual and focusing not on what you haven't done, but what you have done and how it was successful, I think will really help in September. Going from 0 to 60 in under, or 0 to 100 in 60 seconds is hard. So sort of highlight the gradual changes that you're able to implement. I think that will really help people along, because if you've been working from home for the past year, it's often difficult to remember how much actual safe interaction is actually already happening out there in the world. We have large sectors in our community with safety plans that operated safely even without vaccines. So once you add vaccine to that, we're in a really good spot.
That's great. So let's talk about how we get ourselves back together. So I want to move on to the go forward guidelines, their implementation and their customization. So I'll start with a lead-in question, and I'm going to actually take the first stab in answering it, and then I'll defer to the doctors for follow-up. But the question is this: when will the revised go forward guidelines be ready? When will they go into effect, and why was the primer released when it was? So the revised go forward guidelines, we expect them to be ready sometime in June. They will go into effect on or about August 1st. So after most schools are completed their spring and summer terms. And the question, why was the primer released when it was? There was a little bit of criticism that perhaps we were tone deaf in our release when things are difficult. But we looked at it anticipating as I said in the beginning, a more optimistic future, and we wanted our planning to follow along towards that, given the province's vaccination regime and its the abundant supply of vaccine, etc. So that's why the primer was released when it was. So I'll defer to Dr. Henry or Dr. Gustafson or Dr. Emerson. Any additional thoughts on that?
I'll turn that one to you, Rekha.
Okay, so a couple of things. One is that we were, since we've been, and Brian, please add to this, but we've been working with large institutions as well as the ministry for some time, and became very aware of how much time you need to plan. Many, but not all institutions are very large, and decisions needed to be made in April, May. And so we felt that it was important to communicate what's anticipated for the fall to allow you to plan. And again, that anticipation is based on what we know about this infection, what we know about the vaccine, and what we have seen in other parts of the world that are immunizing, and the fact that immunization is happening all around the world. The other thing I would like to say is that although perhaps the go forward guidelines were a little bit ahead of public communications, you will also see over the next little while the communications to all other sectors to support them through their planning to return to their full functioning. Not all of them are as big as the post-secondary sector. Not all of them need as much of a heads up. And so that was the goal, and that was I think the timing was actually quite important. And it was unfortunate that we happened to be having just after spring break an increased number of infections. And certainly that may have led to a cognitive dissonance, but I think it was important not to miss that opportunity to allow you to plan.
Agreed, thank you. The guidelines seem based on the K-12 model. Our students travel on transit, they're intermixed, they're in different rooms constantly throughout the day. How is post-secondary being treated differently than the K-12 sector?
Do you want me to start that one, Bonnie? So K-12 sector, some of the examples from it's not actually based on the K-12 sector. I think that's important to say. And in fact, the situation is fundamentally different, because at the moment, half of the K-12 sector is not going to be immunized. At the moment, we have a product that's approved for 12 and up. So in some ways, the post-secondary sector is in a different situation, because the overwhelming majority of people on campus will be eligible for vaccination. One of the reasons we refer to the K-12 sector is because we have gone through the exercise of taking a very large sector through a pandemic, working together, and some of the things that we have learned from K-12 have been applicable. So, for example, things like there was little transmission in the structured classroom setting, but if people got together for all the staff, unimmunized staff went out and had dinner afterwards, then you would have you could have a potential, or had a party, you could have you could have transmission, and people attribute it to schools and the classroom. So some of those things that we learned, and we learned to address over time with K-12, we hope not to have to repeat. But it is different. You have an adult population, all eligible, or just about all eligible for vaccination. And you're right, there's more intermixing. There's also sort of a greater ability to take personal precautions. So I would say that the reason we referred to the K-12 sector was because of the size of the sector, and I would say that one of the biggest things we've learned, Brian, I think you would agree, is going through this exercise hand in hand was of great benefit.
Agreed. Given the risks of in-person classes, why not a phased return with a substantial number of online and hybrid course offerings where pedagogically appropriate?
So that, I think it goes back a little bit to my previous comment, is that actually classes themselves are not, do not appear to be posing an excess risk. And so one of the things I would say is that that the biggest thing that the COVID-19 pandemic taught us is that structured settings with even the most basic safety plans actually are much safer than informal settings. So and again, that's in the unimmunized state. Once we've got the population immunized, it's a whole different ballgame. But I would say that the classrooms, the return to classrooms is not something that we consider to be posing an excess risk above and beyond existing in the community. And so again, we needed to learn that. We didn't know that all those safety measures were put in place with the assumptions that they work. One of the things I learned, and Dr. Henry, I don't know if you agree, and Dr. Emerson, but I'm actually shocked as how well they work when they're implemented. Those really rendered COVID-19 from a highly transmissible infection to a poorly transmissible infection. And so I think returning to the classroom, especially knowing how difficult online learning has been for young people, is actually a really important priority without an excess risk.
Agreed.
No, I absolutely agree with you. I think we have learned from many, many different settings that having some basic things in place, even without being immunized, has made a huge difference. And in every single setting, and there are things that are riskier than others, but it's the uncontrolled social connections that where we see transmission happening the most.
So on that, and obviously we spent the last 15 months learning how to be physically distant, and as we transition back, though, that requirement has been essentially removed for post-secondary. So, and it's a question on many people's minds. But what threshold of risk has been used to evaluate the statement in the primer that classes can be scheduled without physical distancing requirements? So that is to say, 30 students in a 30-seat classroom, 50 students in a 50-seat classroom.
Again, I just would like to refer to what we've learned is that COVID-19 is transmitted through prolonged close face-to-face contact. The 2 meters distance was sort of a helpful communication tool based on how far droplets travel to get people used to the idea that you don't crowd in. But students in high schools were not 2 meters apart in classrooms, and yet classrooms were a very, very small part of overall transmission, like truly minimal. So what we know is that where COVID-19 is transmitted is where people are intermingling, hugging, yelling, singing, kissing, talking loudly because the music is loud, sitting in a classroom without sort of that close face-to-face contact that you might have in a bar where you're leaning into somebody and trying to talk over the music. Just empirically, we have learned did not pose an excess risk. It's not possible to reduce COVID-19 transmission to zero without vaccination, but we found that actually that setting was less likely to transmit than your home or another informal setting. And now we have vaccination to add to that. So that's why that statement. Dr. Henry or Emerson, would you like to add to that?
No, it's exactly that. We've learned a lot more about the situations. And so it is the situations where the virus is likely to spread more widely to other people, where through aerosols and through movement in the airwaves. And there's been a lot of sort of public discourse about, is this airborne transmitted? But what we have seen is that it is transmitted in settings where people are close together, where there's not good ventilation, where there's crowding in informal situations, and even simple things like having people sitting as in not close together, but as far as you can. But even opening windows makes a huge, massive difference in preventing that. So we've learned a lot, as Rekha says, and we know that those are not the risky settings. The risky settings are when you're crowded together in a poorly ventilated indoor space not having a structure to what you're doing.
Okay, I'm going to ask two more questions about go forward guidelines before moving on to controls. In consideration of the mental health and well-being of faculty and students, is a phased return to face-to-face class for the fall being considered?
I would just say we know a lot about the decrease in people's mental health that has happened with classes not being able to be in person, and learning challenges that many people have had, particularly young people. So we all have challenges with anxiety and risk, and this is where we need to support each other to learn from the things that are working, from this, to gain that confidence in how we can get back safely. And we have vaccines to protect us, and we know that they are working. So I would just encourage people to recognize that we all have levels of risk tolerance that are different, and that we need to build on the successes and focus on what we can do, and that getting back to post-secondary in-class learning for young people is just so crucial after all that they have been through in the last month or year and a half.
Thank you. Last question on go forward guidelines. Many faculty, staff, and students teach, work, and learn at more than one institution. How will work and movement be structured to limit community spread risks?
I think, should I start with that, Bonnie, or would you like to go? So again, we're doing a province-wide immunization campaign. So again, some of these things that we got used to, such as limiting movement between different places, this was all in the context of an unimmunized population where a virus that we were learning about was spreading. So those measures, this idea that you can't move between two institutions, fortunately, we won't have to do that. I would say that the thing that we will have to do is that if you're sick, stay home. If you're in a place that happens to have an outbreak, if we have outbreaks, that may not be the time to go and work in another institution. So what we can now do in the context of vaccination, I think this is sort of the crux of the value, is that we can go from these generalized measures that have limited so much of our functioning in society to targeted measures when you're sick. And so things like you can't move, and we didn't say you can't move before, but we certainly limited movement between long-term care facilities because they were very, very high risk sectors. In the absence of vaccine, those are not the kind of things that we will need to be worried about unless there is a specific concern with an outbreak of COVID-19 in a specific area. So we're going from broad measures to targeted measures, and thereby returning to a much more functional and flexible way of being.
Yeah, I would only add that we have learned a lot about this. There are a huge number of just even healthcare worker training programs in post-secondary institutions where we've learned how to safely move people in the absence of vaccine between practicum placements and places that they, in class or in-person learning. And we have done that, so we need to build on those successes, but we now have vaccine as well. And as a society, we will be able to open up more and reduce those travel restrictions, both within the province, within the country, and internationally over the coming months.
So that's very encouraging. Let's move now, the time we have left, let's talk a little bit about controls. And this is probably the most popular question that we're asked or we discussed around the Go Forward Guidelines table. And to your credit, Dr. Henry, you've conditioned us well in this regard, but the question is this: will masks be required at PSIs in the fall, and under what conditions?
I think masks have a role to play when we have certain level of transmission in our community. We know that they protect us in indoor public spaces, and right now there's important places, particularly if you're moving about and we don't know, and we have a lot of transmission in the community. So yes, there may be a time come next fall when we might need to wear masks again in classrooms, in other settings, when we're moving around in a post-secondary institution. And certainly if there's outbreaks, they may be beneficial. We have some data that supports that if you wear masks in residences, that you reduce transmission. But it all is in the context of how much virus we have and how protected we are. So we don't yet know everything about what next respiratory season is going to look like. So there is conceivably times where masks will be an important measure to add to everything else that we're doing. Masks in and of themselves are not the only thing that reduces transmission. They are what we call the last level of protection, but they do play an important role when we have transmission in our community.
One thing, Matt, if I could just add to that, and this is a little bit around going from generalized measures to targeted measures, which is what Dr. Henry was talking about. The other thing about planning for the fall is that wearing masks or not wearing masks is not something we need to know right now. That's we are going to have 3.5 more months of experience with the virus where we're more vaccinated and the world around us is more vaccinated. And that's a measure that we can modulate on a much shorter term. So I think the important parts of the conversation right now are the planning we need to do that can't easily be shifted. And as Dr. Henry mentioned, masks will be available to us should we need them. And so I think, or should they be of benefit? But I was thinking about this question last night because I knew it would come up, and just wanted to again remind us all that we have 3.5 months for that, and that's a relatively quick intervention that can be put in or taken out as necessary.
Agreed. So let's talk a little bit about cleaning and aerosol droplets. So why the emphasis on surface touching and cleaning over CDC recommendations on controlling exposure through aerosolized droplets and improved ventilation systems?
I don't think it's one or the other. I think we need both. And yes, early on, there was, when we were not understanding, we were still learning about how the virus was transmitted, we put in place the measures that we would take normally for any droplet spread virus. And it is important, and it continues to be important, to clean our hands regularly and to have regular cleaning of surfaces in places that are high touch surfaces, because we know this virus, we know influenza, we know other viruses, and particularly viruses, but other microbes can live on those surfaces. And then if we touch those surfaces and touch our face without cleaning our hands, then we can be infected and self-inoculate ourselves. So we know that I think people went a little bit overboard because it is something that we could control early on, and I cringe at how we've demonized elevator buttons, for example. But it is important that cleaning your hands is something that we know prevents people from getting infected, and alcohol-based hand sanitizers are using plain soap and water are important. It is one on the continuum of measures that we need, and we know as well, and I call it an obligate airborne or aerosol transmitting virus. We know that it doesn't transmit as well as the droplets get smaller and smaller. It's not like a vapor, but it is, so ventilation is an important consideration. Particularly, we know that if you're in a crowded environment indoors with poor ventilation and somebody is sick with the virus, so that's the other part, then the risk of transmission goes up. But all of these, and so ventilation is important for that. It's important for a whole bunch of other viruses that we have and microbes that circulate in the air otherwise as well, that we have not paid as much attention to. So yes, I think it is important to review our HVAC systems, to look at how well they work at protecting us from whatever is in the air that people can be exposed to, whether that's microbes, so tuberculosis, measles, influenza, and of course, COVID. But it also is, well, you know this, it's around other things that that we can be exposed to through poor air quality as well. So those are important things to pay attention to. But it is really, the risk goes up when you have transmission in the community, and as more people are protected through vaccination, those risks will go down as well.
Okay, and on that, just a follow-on question, this will be the last question on controls. Should post-secondary institutions not ensure that WorkSafe BC requirements and ASHRAE standards for ventilation are met, and will there be any enforcement of that?
And again, these are not questions I can answer. Post-secondary institutions are workplaces like every other workplace, and so my expectation would be that WorkSafe standards would be met.
Agreed. Okay. Couple more sections here before we close off. A few questions here. These relate to international students, and I think we know the answer to this, but will international students be required to be vaccinated before arriving in Canada?
Yeah, also something that's not actually in my area to require or not require, but I know the federal government is working on that. I think one of the things we must recognize is that we have a huge global inequity in access to vaccine. So there may be, and there's very likely many students who don't yet have access to vaccine in their home country. So I believe, should have a process in place for making sure that people are provided with immunization when they arrive, and that's something that we can plan for as we have more vaccine available. It is something we're doing with groups of people like the temporary farm workers who we are so dependent on. When they arrive, they're in quarantine and they're provided with vaccination. So there are many things that we can do to support international students coming into our institutions come September and through the summer.
So beyond any federal requirements, does British Columbia anticipate any special requirements for international students?
Not. We are working really closely. We have meetings regularly with our federal counterparts about international students, and that's one of the things we talk about. So no, we will be aligned nationally with what we're going to provide for international students and how we can make sure that they are safe and our communities are safe. And immunization will be an important part of that. I can commit to that. We believe that if people don't have access in their home country, then we need to find a way to support them to be immunized on arrival.
Agreed. There are a handful of questions about outbreak, but could you, and so notwithstanding it's possible that we may have outbreaks on our campuses in the fall, can you just touch on the role of the provincial health office, public health offices with respect to outbreaks on campus and what that might look like in the fall, including contact tracing?
Yeah, so I'll turn that to Rekha, because we have local public health in all parts of our province. So your local MHO will be your contact, and I know many of you probably are quite familiar with who your medical health officer is in your area. But if not, we can connect you with them as well. And Rekha, maybe you want to walk through our usual process.
Absolutely. So many of you, as Dr. Henry mentioned, already know who your local medical health officer or who your local public health unit is. One of the things I think we put in the go forward guidelines is that if you don't, make that connection now. We have managed at the local public health level, where I worked until about a year ago, we managed communicable disease exposures on university campuses on a regular basis, not very often, but on a regular basis. And we often work with student health and the administration. So just thinking through what you would do if there was an exposure. And again, it doesn't happen often enough, or it happens infrequently enough in the past that as staff change, you may not know who your people are. And so just making sure that you do know who your people are, and the thinking through, probably one of the most important things is how would you contact students and who would contact the students and the staff, you know, having email lists, making sure that you just think through how you would do that. I think that's a really good part of planning. It's not difficult. It's just difficult if it's Friday at 10 o'clock and you don't know who to call. And there are very simple but important outbreak management protocols that are in place. They're easy to implement if you know they are there. And fortunately, we don't use them often enough to for excuse me, for everybody to be aware of them. But I would say that's an important part before September to get in place.
Absolutely, and I'm just thinking, you know, the most common things we see and have to deal with in post-secondary institutions are tuberculosis, somebody who has an active case of TB. We have meningitis outbreaks periodically that you'll be familiar with, and recently we've had clusters of measles cases and mumps actually as well in universities that we've worked with you to help manage. So those are all things that we do routinely. So as Dr. Gustafson says, make sure you have the dust off those protocols, make sure you know who to call, and some of the very simple things like making sure we know how to contact people. And this will be important coming up in this year because we have that increased sensitivity and we need to watch around COVID. So knowing who's in your classroom, who showed up for class today, having the ability to contact them quickly if need be.
That's great advice. Last formal question, and this one is related to testing. Will post-secondary institutions have the ability to offer rapid testing on campus in the fall, and under what conditions or circumstances?
The short answer is absolutely. So there is different types of rapid tests. So there's tests that you can get a result rapidly and it's very accurate. And there's point of care tests, some of which are more or less accurate. But we would support having access to testing in every post-secondary institution, particularly through your student health services. And sometimes it will be helpful to have access to rapid tests, not for sort of randomly testing people, because we've realized that there's a relatively low yield if people are not sick. But if somebody is sick, being able to tell if that's COVID very rapidly will be important. And I know there was, at least in one campus at UBC, there was a trial of one of the point of care tests that was done, and we've learned quite a bit from that. And I don't know if you want to add some more there, Rika.
So just what Dr. Henry said, rapid testing has been, again, one of the things that we hear a lot about in the media. I think that a really important first step is to make sure that either your student health service provides testing, actual laboratory, ordinary testing, or if not, you know where students or staff would go should they need to. I think that's a really helpful, again, a really great way to support your staff and your students to know where they would get tests. Rapid tests, as Dr. Henry mentioned, have utility in certain settings, such as we've had a bit of success identifying some clusters, for example, in residence, because young people are much less symptomatic. So it being able to do broader and more screening type testing has been useful, especially in the context of no vaccination. So rapid testing will certainly be available. I think we'll need to work together to figure out how useful they are, especially after vaccination. They do require, somebody to do it, somebody to keep track, somebody to respond. And I think over time, I anticipate, happy to be wrong, over time, I think testing will move much more toward the people who are sick enough to be tested. Because the primary reason we test for a condition is to whether it changes management. So if it's useful, absolutely, it'll be available. And if it's useful, we'll maintain it. But we'll learn that together, I think, over time. What is the role of testing in an immunized population? It's not going to be the same as it is today.
That's great. And yeah, I personally have found the discussion today very, very informative and helpful. I do have a closing question for you, and then I'll wrap up after your remarks. What's the biggest challenge public health officials see in the future as it relates to COVID? I guess said another way, what keeps you up at night?
I haven't slept in over a year and a half, so there's there's so much that we know. There's so much that we are still learning. So I think the thing I'm much more confident of the future now, but we don't know when. And I said this the other day, we're not out of the woods until we're all out of the woods. And that's not just in this province, it's around the world. So when we look at what's happening in Brazil, we look at what's happening in India and the tragedies that are unfolding there. But from a scientific perspective, it's also the more this virus has a chance to replicate, the more it's going to have spelling errors, and we're going to get new strains and new mutations arise. So I have worries and concerns that if we don't, as a global community, deal with some of the most tragic and challenging outbreaks that are happening around the world, we're all going to continue to be at risk. The good news is we have a vaccine platform, the messenger RNA vaccines and the viral vector vaccines that can be modified quickly. But we are still in a place of risk because so many people are still susceptible globally and have not been immunized, and we're seeing that play out. So those are things from a bigger picture perspective that I worry about. I think that we have learned that we can do things really supportively together in British Columbia that make a difference on a day-to-day basis. And some of them are very blunt instruments, and we have to be prepared to use those if we need to. But we have we are moving into a new world with the protection that we're seeing from the vaccines that are working here in this province, in this country right now. And that is going to allow us to get back to a life that we need. We can't keep with these blunt instruments for long periods of time because we know they themselves have dramatic negative impacts on families and communities. So it is that unknown of what's happening around the world and how do we protect people here with trying to move forward again. But I think I'm mostly optimistic. For what we've got here, what I'm worried about is if we don't act as a global community to support other countries, then we're all going to still suffer.
Thanks for that candid response and that message of optimism. Given the time, unfortunately, we have to bring this town hall to a close. On behalf of all of us, I'd like to thank Dr. Henry, Dr. Gustafson, and Dr. Emerson for spending the time with us this morning. I think I can almost hear the virtual applause throughout the province. I think I speak for all of us when I say how informative and helpful this morning's dialogue has been. I'd also like to thank the Go Forward Guidelines Steering Committee, the Ministry of Advanced Education and Skills Training, and the Provincial Health Office for their hard work and continued support, not only on this town hall, but really throughout the pandemic. In closing, just a reminder that this event has been recorded and we will be sharing the link with institutions imminently. In addition, we hope to schedule additional engagement opportunities with Public Health Office representatives in the coming weeks. So with that, once again, our thanks to all. Be well, get vaccinated as you are able, and we wish you all the best in your planning activities. Thank you.